listening to the Agent Survival Guide podcast, a podcast for today's insurance agents. Informing, educating, empowering, improving the way you do business in an industry that's anything but static.
In today's episode, fact-finding helps you get to the bottom of your client's health insurance wants and needs, and doubles as a rough outline for your conversation. Questions to ask clients shopping for an Affordable Care Act plan, written by Emily Ryan. When working with a client who is shopping for an ACA insurance plan from the federal marketplace or their state marketplace, there are a series of questions you should ask to better serve them. Ask these 8 questions in your meeting to understand your client's needs and what they might be looking for in their health insurance plan. Number 1. How often do you typically need health care each year? Asking how often your client visits the doctor each year can help you determine if they'd better be suited for a plan in a higher metal tier to have more costs covered, as long as they're comfortable with a higher premium. Maybe your client only visits the doctor once a year for their annual physical, or maybe they have conditions they manage with more frequent visits to providers. They may feel as though the lower deductible and lower copays are worth the higher premium. You can compare metal tiers and estimate premium costs with our ACA Metal Tiers handout, which you can find the link to in the episode notes. Number 2, what is your estimated annual household income? Subsidies through premium tax credits and cost-sharing reductions help to make marketplace coverage more affordable by significantly reducing out-of-pocket costs. Your client's annual household income is used to determine eligibility for these subsidies. HealthCare.gov has a calculator you can use to estimate clients' subsidies before deciding on a plan. You can find the link for that in the episode notes. Remind your client that if they qualify for cost-sharing reductions, they must select a silver plan to apply those savings. Premium tax credits are available on any metal level. This is also a great time to remind your clients to reconcile their premium tax credits. Number 3, how much are you comfortable spending each month for health insurance? Some clients may feel influenced by budget concerns. Subsidies can reduce the amount of monthly premiums they'll pay. However, if they're not eligible for subsidies, clients may feel more comfortable choosing a lower metal tier of coverage to reduce their monthly spending. Catastrophic plans can be an option for clients who are looking for enough coverage to act as a safety net, but don't use health services often and aren't willing to spend more than what's necessary for health insurance. These plans are only ideal for clients who want protection from worst-case scenarios, such as getting very sick or injured. Number 4, are your doctors in a particular network that you'd like to remain in? When evaluating your client's current health status and medications, consider if there are doctors or specialists they'd like to continue to see. This can help you decide on a plan with a particular network if your client feels that's valuable to them. HMO and EPO plans limit coverage to a local network of physicians and facilities, and typically will not cover out-of-network care, except for emergency medical services. These plans can be more affordable options for clients with chronic conditions. HMO plans require a referral from a primary care physician to see a specialist, while EPOs do not. Because of this, some individuals may choose an EPO or PPO plan for added flexibility. However, these more flexible plans are also more expensive. Consider in-network flexibility, coverage, and affordability when your client is choosing a plan. Number 5, do you take any prescription medications? Those with chronic conditions or those who take prescription drugs may want to decide between an HMO or EPO plan that has better coverage for their condition. Typically, these plans have more coverage for prescriptions than PPO plans. Number 6. Have you had a significant life event recently? If your client recently got married, had a child, lost health coverage, or has moved, they're eligible for a Special Enrollment Period, SEP. Your client will have 60 days to select new coverage through the marketplace with this SEP. If they have not experienced any of these events, they will have to wait until the ACA Open Enrollment Period, OEP, to enroll in a plan. Number 7. Is dental coverage important to you? Dental services for adults are typically not covered as part of marketplace plans. Some carriers do offer dental benefits as part of their plan, but this isn't common and may not be available in all areas. We recommend asking if your client is interested in receiving dental coverage. A supplemental dental, vision, and hearing plan or standalone dental insurance plan may be a great choice for these clients. Number 8. Do you have life insurance? Think about the other products in your insurance portfolio. Are there any products your client could benefit from, such as life insurance? Life insurance can provide peace of mind and protection in case of an accident. Consider this your opportunity to offer your other services to your marketplace clients. Asking your client these important questions will help you be a better agent and make even more sales. Use these questions from this episode for reference in your next client meeting to better understand your client's needs. And remember, you don't have to have the answers to the tough questions all on your own. With Ritter Insurance Marketing, the FMO that powers this podcast, you have access to sales support, on-demand training, and resources to help you succeed with one free registration. You can grab the link to register in the episode notes, and you can email us at asgpodcast@ritterim.com if you have any questions. Thank you for listening. We will see you next episode. The Agent Survival Guide podcast is a production of Ritter Insurance Marketing, an integrity company. This episode was written by Emily Ryan, script proofing by Sarah Ruppel, recording and production by me, Tina Lamoureux, podcast design by Urban Rivera. Follow along with our show wherever you like to listen.